A very good evening to all of you. Today, we are going to learn about or try to understand about the pelvic floor muscle and some dysfunctions and the exercise. The name of the exercise we all are aware so far is the Kegel exercise. So we will try to understand what is Kegel and in which cases we should recommend Kegel to our patients and our people. And in which cases we should not give Kegel. Instead of giving Kegel, we should try to give them the reverse Kegel. So we will also understand the concept of reverse Kegel and the Kegel. Okay. So hi everyone, me, Dr. Sunita Patel. I'm from India. I'm a physiotherapist who passed in 2006. Then after that, I started pelvic floor rehabilitation. It came in my life. So fortunately, I am that it came in my life in 2015. And since 2015, I'm practicing pelvic floor as my priority. Actually, this is my expertise also. So that is the time when I came into connection with the Kegel exercise. We all know that Kegel was a part in our curriculum also. It was written somewhere into the books that whenever person is suffering from urinary incontinence, we can help them with the pelvic floor exercise, a Kegel exercise. And most of us are aware this word, the term Kegel. Same term came into my life in 2015, and it was very hard for me to understand that. But slowly, with the practice, with more knowledge, with reading, I understood the concept, what exactly it is. Unfortunately, whenever we are doing Kegel exercise, we are not targeting the right muscle. The right muscle means the right pelvic floor muscle, because the pelvic floor muscles, these are the muscles which is situated inside the body. So access and the palpation is very hard of this muscle, and we were not taught about that in our curriculum. So that's why we missed that how to palpate. And if the person is doing Kegel exercise, we don't know that the person is doing it in a correct way or they are not doing it in a correct way. We are just trying to figure out or just trying to go through the protocol which has been taught to us through that, through the books. That Kegel exercise is a squeezing of your pelvic floor muscles and holding it for 10 seconds, repeating it 10 times, and then doing 3 sets. And do it in the morning, in the afternoon, and in the evening. So this way you can practice the Kegel exercise, the squeezing of the muscles and holding it for 10 times in morning, afternoon, and evening. So, and repeating that like up to 10 seconds. So this is what is the concept. But if I'll tell you, okay, squeeze your pelvic floor muscle. So I don't know that you are doing it in the right way or you're not doing it in the right way, isn't it? So palpating this muscle is very hard. I don't know what happened. Someone, don't do scrubbing. Who is doing it? Please stop. Please stop doing this. I'm not sharing my screen with anyone. Please don't disturb the session. Who is this person? Please don't do that. Okay. Yes. So we don't know that the person who is sitting in front of us, they are doing it in the right way or they are not doing it in the right way. Okay. Because these muscles are present inside. So this is what we are going to understand, the concept Kegel. And by the end of this webinar, I think you will have the right understanding of performing the right Kegel exercise. Okay. And in which cases we should do that. Just for more understanding, I have created one PPT presentation, and I'm going to take you through the presentation. So by making this concept more you can understand that in a better way. We have again 22 people in the chat box, so I'm going to admit them all. Okay. So now, Kegel exercise. So today's topic is Kegels and reverse Kegel. And this is the pelvic bone, and which is creating a framework, beautiful framework. And the floor of this framework is covered by the pelvic floor muscle. And Kegel is an exercise which we are doing for strengthening of the pelvic floor. creating the activation and increasing the strength into the pelvic floor. Still, if I'll ask you that who is Kegel, what is Kegel? So we all know the squeezing of pelvic floor is a Kegel. But who is Kegel? Who invented these Kegel exercises? So there was a person who was an American gynecologist, Dr. Arnold Henry Kegel. So he is the person behind these exercises who, told the world that we have muscles present down there into the perineal area, and these are the group of the muscles, like the skeletal muscles, and like we can squeeze and we can strengthen, we can increase the power of other muscles in our body, skeletal muscles like biceps and quadriceps and all other muscles, we can increase the power. Same way, we can also increase the power of these muscles, which is lying inside the body. And if these muscles got weak, they will not perform their function optimally. So if to just increase the efficient functioning of this muscle, and whenever the muscles are weak, we can definitely strengthen those muscles. So the pelvic floor muscle, and he's the person behind this concept. So he told this to the world that, okay, so muscles are present here into the perineum, and squeezing of these muscles is like this, the pelvic floor muscle is that is going to increase the power. And this concept he put in front of the world within in 1948, he published his idea in front of the world. And he told that, oh, squeeze your muscles around the pelvic floor, pelvic region. So they are the muscles of the floor. Squeeze them, and squeezing them increase the power. So this is the concept he published in 1948. And it was well accepted by the whole world. Slowly, he started presenting that in front of the world, all the conferences, and the idea came. But the important thing is that yes, he was a urogynecologist who was assessing the females, and then he just invented this particular squeezing. He felt the squeezing of the pelvic floor inside the female vagina once he was doing the palpation. Then he did again and again. He practiced the same thing with the different females, and he found out that the muscles, something is present there who is creating the squeezing on the fingers. And then it was the pelvic floor muscles. And when he started presenting this idea, so normally he told the world that muscles are weak. If the muscles are weak, you can create a squeeze and hold them for 10 seconds, repeat it for 10 times, do it 3 sets. So this is what the concept he told, because that's a normal principle concept is applied for and to increase power in throughout every body, every muscle of the body. So same concept he applied over the pelvic floor muscle. But the one major thing which was behind that is that use this exercise when your muscles are weak. So if your patient is suffering from issues when muscles cannot hold, they are weak and they are saggy and they cannot perform their function efficiently, they are not effective, they cannot create effective squeezing. So in this way, we can increase the power. So now what are the conditions when the muscles cannot create a squeezing? So that is okay, squeezing around the urethra, squeezing around the vagina, squeezing around the anus. So if that power is less, so in these cases, we can give them exercise, pelvic floor exercise, these exercise, and he named those exercise as after his name. So that was a Dr. Arnold Kegel who invented it, and he named it after his name. So that's why we are calling it as a Kegel's exercise, Kegels. And it is mentioned into all the publications that Kegel means squeezing of the muscles. So that is also telling us another fact that whenever the muscles are weak, we have to give Kegel. So means squeezing is effective when the muscles are weak. So when the muscles are weak, what can be the issue? The issue can be urine leakage. The issue can be prolapse coming from the vagina or from your anus region, piles, hemorrhoids. That is also a veins prolapse, protrusion. So whenever you have the muscles don't have a strength to hold something, we can definitely tell the person, oh, your muscles are weak, they cannot create a squeezing. So try to squeeze, hold, squeeze and hold. So Kegel exercises, squeezing exercises are only for the cases when the muscles are weak. Muscles don't have a tone to create a sustained, they don't have a sustained tone to create a optimum compression around the openings. Now, this is a concept we understood that Kegel is not for the cases when muscle is already spasmodic, when the muscle is already short, when the muscle is already tight. So in case of constipation, when you really want to pass that stool. So if the muscles are constipated, we cannot give them Kegel. Kegel means squeezing. You can, if I'm tight, you can't squeeze me. So whenever issues are there related to the tightness or hypertonicity, muscle has a hypertone. In those cases, hypertonic cases, we cannot give Kegels. We cannot give squeezing. Now, what can be those cases when the muscles are tight? Assume that muscles are tight around the urethra where we are passing the urine. So if urethra, the muscles are tight, so what is the process? We should relax those muscles. We should not increase the power into these muscles. Already muscles are tensed, short, spasmodic. So try to relax the muscles. So in that case, Kegel will not be effective. Same way, if person is having kind of tension all around those muscles around urethra, and if he's a male person, so ejaculation of the sperm can be painful. Urination can be painful. So whenever urination, ejaculation is painful in male, we cannot give them Kegel. Same way, when we have muscles present around the vagina, all around the vagina, we have an opening around that. I'll explain you everything. And the condition we are calling it as a vaginismus. Vaginal muscles are spasmodic, shortened. So in these cases, again, muscles are tight. We need to relax them. No Kegel into vaginismus. And if the female is having pain during penetration inside the vagina and even painful sexual intercourse or painful gynecological examination, painful palpation, internal palpations. So in these cases also, we should not advise them Kegel exercise because we need relaxation. Tissue should be relaxed and they should have a mobility. Okay, so there are two concepts. Do we want to increase the mobility or we want to increase the strength? So whenever we have to increase the strength, Kegel will come. Whenever we have to increase the mobility, reverse Kegel will come. Reverse the Kegel. So what is the Kegel? Squeezing. And what is the reverse Kegel? No, don't squeeze, releasing, relaxing. So this is the concept. And same way, the muscles, whenever the muscles are around, you can understand around the anal region, external sphincteric muscles, sphincteric compressors, if those muscles are tight and person cannot defecate, he's having a defecation problem, definitely we cannot give them, we cannot prescribe them Kegel because Kegel means you're trying to increase the power, but muscles are not relaxed. So first principle is always relax it. So in this case also,
Yeah.
we cannot prescribe reverse Kegel. We cannot prescribe the Kegel exercise. So, so now this is a simple concept. You understood the Kegel means squeezing and reverse Kegel means releasing, relaxing. And the concept is given to the world. The Kegel concept is given to the world by Dr. Arnold Kegel. So there's a man behind that. And we are so thankful that person that not only the gynecologists, urologists, and all the people who work with the perineum, even we are the main people. We are a physiotherapist, and we really work with the muscles. So this is the exercise which was taught to us by this gynecologist, urogynecologist. And otherwise, as a physio, we are mostly kind of avoiding some internal palpation. And that's why, this part is not also, it is missed in our curriculum, and we have not been taught in detail about these issues. But this is the same, the muscles which is present here. So now you understood the concept of Kegel and the concept of reverse Kegel. Now this Kegel means squeezing of the muscles and reverse Kegel means releasing of the muscles. Now what muscles, which muscles? The pelvic floor muscle. Now this is what we are going to learn right now. And I'm going to make you understand. I'm going to give you some understanding of these muscles also. Okay. So, okay. So I have the model in front of me. This is the pelvic bone. We are all familiar with the pelvic anatomy. So I will not go into detail, but still this is a fusion of three bones. We have a pubic, ischium, and the ilium that is creating this bone, one side of bone and other side of the bone. They both are joining together with this pubic symphysis, a connective tissue. And the same way, if I just rotate it and you will see, palpate at the back of the person and even in your body, you can see that we have again the ilium is joined with sacrum, and with the two ligaments, sacroiliac joint, okay, SI joint. We are aware about this. And then we have all these lumbars attached, the spine is attached with this. So lumbosacral and the pelvis, we understood this. And this is whole iliac crust you can feel. And we have ASIS, PSIS, and then you can come forward. This is the pubic tubercle, this is superior tubercle, inferior tubercle. We can palpate that. So this is a whole bone. And if I rotate this bone, so this is what this bone is creating. These two bones from side to side and back sacrum, they are creating the wall actually. So the room where you are sitting, so assume the room we are sitting right now is the created by this bone. Okay, so this is the lateral, front, and the back side. Everywhere we have a wall which is created by the bone, bony framework. And on the top of that, we have abdominal muscles and the whole lateral, you can say obliques, internal obliques, external obliques, everything is there in the upper side. So abdominal cavity is present. And now this is pelvic region, pelvic bone. And now if I show you, just give me a minute. So this is again a different model. So you can say the bone is the framework is created by the bone, but the framework is empty from the down part here. We don't have anything. We don't have any bone here. Why we don't have any bone here? Because we have some excretory organs present. And those excretory organs has to excrete something outside. Now, which organs are present into this particular part? Pelvic organs. Now, how many organs are present in a male body and how many organs are present in a female body? So I can just show you. This is one organ, which is the bladder and bladder of a male, because they have a prostate attached at the bottom. And the urethra is also passing. Bladder is, the function of the bladder is receiving the urine from the ureters. So kidneys are doing their work. They are sending the urine through the ureters, and bladder is like a reservoir. This urine is filled up inside the bladder. Okay, and then the filling, its main function is expanding. So they will fill up. So filled up with the urine. So holding the urine is the main function of the bladder. And for that, we have different layers of the bladder is also present. We have a peritoneal cavity. We have a detrusor muscle, which is made up with the smooth muscle detrusor. You might have heard about the detrusor hyperactivity. Okay, overactive detrusor, underactive detrusor. So these are the conditions related to the bladder. Then we have this internal mucosal wall. And into this mucosal wall, most of the time, if some issues are going on with this, is the infection, inflammation. So those kind of tissue can create an infection into that mucosal wall. So that can give again, it can restrict the expansion of the bladder because inflammation is there, swelling is there, bladder can't expand. In this way, the holding capacity of the bladder, both in male and female, can be restricted. Because this is the bladder of a male, you can see, and this is the bladder of the female. So they're almost same. There's no difference into the bladder of a male and female. But the difference is the urethra. As soon as the urethra is passing through the bladder, and urethra of the female is just small, very small. It's like a 4 centimeter long, small and straight urethra. But in case of a male, it is a quite long urethra, 17 centimeter urethra, which is passing. And the first, it is passing through the prostate. Prostate is a gland which is attached as a part of the reproductive system of a male, which keeps secreting important fluid for the sperm. Which can protect the sperm. We call it as a semen. So semen is produced by the prostate. So that is also a very important function of the prostate. And now through this, the urethra is passing. You can see urethra is passing through that. And then it is passing through the pelvic floor muscle. So you can assume my finger as a pelvic floor. And then it is going to pass through the penile structure. So this way, the urethra is quite long. But bladder is same in both male and female. There is no issue with the bladder. Okay. But female is having a small straight urethra. So this is the first organ which is present in a male body also, and this is also the first organ which is present in the female body. So where exactly these organs are lying? So these organs are lying just behind the pubic symphysis, like that. So if this is the pubic symphysis here, just posterior to that, this organ is lying here, bladder. Okay, you might have seen that any one of you, if you palpate right now and you have not urinated last 1 hour, so you can apply your hands above than the you can apply your fingers above than the pubic symphysis and press. Once you'll press it down, you will feel some urinal sensation. It means your bladder is getting filled up, and because you are above than the pubic symphysis, it means you are touching the abdominal cavity, the downward part of the abdominal cavity. So what does it mean? That your bladder is present into the abdominal cavity. But some of you who have just urinated, you might don't feel that sensation because your palpation is not going on with the bladder. Your bladder is not filled. It means that your bladder is into the perineal cavity, into the pelvic region. So this whole bladder is like it is like more mobile, and it is going to expand like a balloon. So when the urine is not there, it will be like empty kind of. So it will lie down into the pelvic cavity. The moment the balloon will start getting expanding, it is going to go into the abdominal cavity. So it is highly mobile, and it will going to expand and then inflate and they kind of deflate. That kind of process is going on with the bladder. And we really need, okay, so this is the bladder which is situated, but the bladder is having the urethra, which is going, so whenever I want to, I cannot just fill inside. The body has, they have to kind of, the urine should be there. And after some time, when the bladder will be filled up, we have to go through the voiding process. And during the voiding process, urethra comes into the picture. That is the canal through which the urine is going to go out, and we are going to excrete the urine. So that's the canal which is attached here. Now, this canal is very important. And when we talk about the pelvic floor muscle, you can understand if this organ is here and if there's no muscle, no support downwards, nothing is there. So now what sort of structure we need downwards, which can help us into excretion? Do we really want that urine will come and it will flow out? No, we want some control. So that control, and we also want the support. The organ should be supported by something downward, which can have elasticity, flexibility, strength, tone, which can hold the organs in this position. So downward part, this one, we don't have anything. Now that's the whole part is covered by these muscles. You can see starting from the front to back, the muscles are covering every surface. So these are the muscles of the floor, and we are calling it as a muscle of the floor of the pelvis. So that's why we are calling them as a pelvic floor muscles. Okay, and this is what we are learning today. Now, the muscles, when we say muscles, so muscles, skeletal muscles, they have two quality. Any muscle of our body, they have two important properties. They need to squeeze because we are holding something, we are lifting weight. So the muscles should have the carrying capacity. They should have this holding capacity. They should have that much strength that they can perform this holding. And so it means squeezing, holding, strength. So that's the one property of any muscle of the body. And not only the holding, even the endurance, holding for sustained time. So that is also important. So hold, squeeze, and sustain. So this is a good muscles behavior. And second, not only the one property, squeezing and holding and strength and the power, we also want another property. And the property is movement. How much flexibility is into that, elasticity into that, how much like flexible the muscles can be, how much the fibers can expand. So the relaxation capacity. So hold, squeeze, or relax. These are the two important quality of any muscle. So if you're squeezing, you're relaxing. So these are the two things. Same thing is going on with the pelvic floor. So when we say that, okay, squeeze, so they are creating squeezing. So whenever squeezing means lifting upward. And when we say no, relax, that is means releasing downwards. So this is very important quality, which also applied with the same muscle also, the pelvic floor muscle also. Now, if the muscles are present here into this part like that, and they're coming from, you can see here into this part, they're coming from backside of the pubic symphysis, and they're going all the way towards, they are attached with the sacrum. Can you see? I marked also. So they are pubic to coccyx, pubococcygeus, ilium to coccyx, iliococcygeus, ischium to coccyx, ischiococcygous. So they are all the different part of pelvic floor. And one layer of pelvic floor, where I'm showing you here, is the deeper layer of pelvic floor. You might have heard the levator ani muscle. So this is the levator ani, which is the deep part of the pelvic floor. So when we say that pelvic floor, is it one muscle? Oh no, there are many muscles present into the pelvic floor. So it's not only one muscle. We want muscles around urethra separately. We want muscles around vagina separately. We want muscles around rectus, anus separately. Why? Because every organ has their separate functioning. I don't want that if the muscles are relaxing, they should relax as a whole. So if they will relax as a whole, you will urinate, you will defecate. But this is not a good property. We don't want that. So God has given us different muscles around the urethra. So if you want to create, you can even squeeze that muscles. You can even relax that muscle. So I want to just pass urine. I don't have a feeling of defecation. So my defecation muscle will not relax. Only urination muscles will relax. So this is what we are calling it as a coordination. So we have a nerves which supply those muscles, and according to the sensation which is going to send through these nerves, the sensation will be sent to the brain. Now, which the muscle sensation or the organ sensation? What organ sensation? So if the organ is filled up, a bladder is filled up, so that bladder is going to send a signal to the brain that I'm now completely filled up. I can't expand more than that. The moment this feeling is sent to the brain through the nerves, so this is what we are calling it as a stretch receptors. Every organ, pelvic organ, or every body organ also. Now, in this webinar, we are talking about the pelvic organ. Every organ has a stretch receptors, nerves. So when the bladder is getting filled, so it will be filled, it will send a signal to the brain. Oh, I'm completely full. I can't expand more than that. When you can't expand, okay, so brain is going to send signal back to who? Another organ, that is the urethra. Because urethra is closed, blood is expanding, so that the brain will send a signal to the urethra. Okay, you release, open, and urethra will relax. And this urethra is going to behave as an internal sphincter. So it will relax automatically. We cannot control that. It is again a smooth muscle like a bladder. So brain will send a signal to the urethra, and urethra will open up. It will relax. The moment it is relaxed, urine will start flowing down. So do we really want this urine keep coming out without our control? No. As a people, we are trained to control our system. Since childhood, our mothers, they used to give us some sound. They used to give us some toilet training. Our brain is trained in such a way that we cannot urinate on the way of walking, and we have a specific place. We should search for a specific place. When we will found out the specific place, then only we can go inside and then we can urinate. So this type of training is given to us, and that is a toilet training. And this is telling, so this is making us more special. We can control our system, and there are pelvic floor. So which muscles we have trained actually? So we train the nerves and we train the muscles. So the muscles which is around that area, which can create a squeezing and affecting, that is a voluntarily trained muscle. So in us, even in pets, animals like our dogs at home, so we train them that you cannot urinate here by giving them again and again stimulus, different stimulus. So this is the training which is a kind of there in our in process of our growth. So that is very important training, and whom we train these muscles. Now, if so the same way the muscles are attached around the whole urethra or around the urethra. Pelvic floor muscles are attached around the urethra. If I'll say that, okay, which muscles are attached around the urethra? So you can see, okay, if I'll put this, it can be male or female both bladder, and the urethra is passing down. So let me put it here. So look, this is the bladder, and this is passing, urethra is passing through this. So we have a muscle of the levator ani which is looping around the urethra, and this part of the levator ani, we are calling it as a pubourethralis muscle. Pubic to urethra, there's a kind of looping. So what will happen the moment you will say, no, I don't want to pass right now, and because you are stuck with the webinar, the webinar is interesting for you, you don't want to miss any part. So in this way, what these muscles will do, these muscles will pull the urethra anteriorly. So urethra is already relaxed, urine can come anytime outside, but we don't want the urine to come outside. Muscles are active. So what the muscles will do, as per our wish, the muscles, this muscle, pubourethra, will pull the urethra anteriorly. And the moment that pull will be there, so you can say the angle will be different. So this is the angle you can see here, 90-degree angle. But the moment you will pull it anteriorly, the angle will become shortened. So something is pulling the urethra anteriorly, and that is creating the kinking. Urine will not come downwards. Muscle will pull it. But which muscles will pull? The muscles who have strength to pull. If the levator ani muscle has strength to do this internal upward pull, then only the urethra will get pulled. Otherwise, there's no action. The urine can flow downwards. Now, is it the only this pubourethralis muscle who is supporting it? No. There's other muscles also. So same way, this is the part of levator ani which is helping the bladder. But we have other muscles are also present here around the urethra, and we call it as those muscles are same pelvic floor muscles present in the pelvic floor area in different layers. So we have these muscles, you can see into this part. This is a urethral opening, and this is a vaginal opening in a female. So this is the female structure model, and I can just assume that this part is passing through the levator ani, and now I'm going to put it here. Look. So this is crossing through these layers. Can you see these layers of the pelvic floor? And after that, you can say it is coming outside. So we have levator ani deeper, and we have that is a super deeper layer, and then we have a middle layer, and then we have a superficial layer. Okay, if I'll tell you from out to in, so you can say you have a hair present here over this part, and assume that you are removing the hair if you are a female body, and then it will be some skin. Assume that you are removing the skin. Behind that skin, some layer of subcutaneous tissue, and these muscles will be present. Okay, these muscles around the urethra. So this is urethral opening, and these are the muscles going on from here to here. You can definitely learn this. You can get more understanding about that with our workshops, more deeper learning. You can join any workshop. They will teach you. Even we will teach you. We have recorded sessions also. You can avail that, and you can join us in a hands-on workshop also, live webinars. So many ways of learning this into detail. So this is the one muscle going on from this side, and this is also going on from that side. So these two muscles from both sides of urethra is the part of superficial layer of pelvic floor. And they are going to create a squeeze, relax, squeeze, relax. If you want to pass urine, they will relax. If you want to hold urine, they will squeeze. So they will squeeze means they are compressor. They will compress around the urethra. And once you will squeeze, you will not come outside. Okay. Same way, we call it as a bulbocavernosus muscle around the urethra. So that's a part of superficial layer. And once you will remove that, we will have our sexual organ clitoris as a female. Male is also having their whole, they have a penis, which is already external organ. Then middle layer of this is this part. Can you see? The muscles are coming from all the side. This all muscle completely. And this is urethra. So muscles are coming from all part of the ischium. So now how this is attached? This is attached like this. Okay. So now what is this bone? Ischium. Okay. So through this part, ischium, backward, muscles are coming and they are traveling towards the urethra. So these muscles are urethral compressors. They will come from both sides of the ischium, and they're going to go all towards the urethra. They will just encircle around the urethra. I am a urethra and muscles will come from here, here, and they will do the encircling. It's like a squeezing. I have something, okay. How to, you can assume that it's like you have a pen and the cap. So you can put a cap. So the cap is the pelvic floor muscle. Cap of the pen is the pelvic floor muscle. Now the whole part of the urethra, if it is 4 centimeter long urethra, so mostly 80% of the urethra will get compressed, or the fibers of these compressors are going to loop around the whole urethra and they will compress. Now I am like encircled by something, some kind of you can say rubber band. So this rubber band is like this all around the urethra. So the more elasticity, more strength will be there into the rubber band, the better compression will be there of urethra. So this way, the middle layer of the pelvic floor muscle is most important muscle of the pelvic floor around the urethra, which is helping us into holding the urine. So you can understand that, okay, inner part levator ani is also pulling it. Middle part compressors are creating the whole compression 80%, and outer side we have again bulbocavernosus. So these three muscles are present, which is the part of pelvic floor muscle. They are present around the urethra. So this is telling us that the muscle around the urethra should have good strength. If they will have a good strength, they will be able to hold the urine. They will help us in holding the urine whenever we want. So we want a good tone, a good strength into these muscles, good power into these muscles. Not only the power of squeezing, we want even endurance, that the squeezing should be there for some time. So hold it for some time. So like if I want to stay here, so I might need holding for 5 minutes, 10 minutes. So the muscle should have a better strength to do this function in a better way. Okay, so this is what the good pelvic floor muscle should be. And if the muscles has a good strength, okay, they will they will compress the urethra. And if they will compress the urethra, so we can hold our urine. Now, this is very important functioning of micturition. But if the muscles are loose, saggy, they don't have strength, they will not create a holding around the urethra. So in those circumstances, when I really want to hold my urine, so I will not be able to hold the urine because my muscles don't have strength of squeezing, strength of compression. I don't have that. So this is what is the weak pelvic floor. Is it the whole pelvic floor is weak? No, we need to assess which muscles are weak. So might be the only muscles around the urethra is weak. Then we'll also go into more detailed history, why the patient, what type of activities person is doing, why the urethral muscles are only weak, not other muscles are weak. Okay, so that is very, very important area when the muscles are weak. So we will tell, okay, strengthen your muscles, start Kegel exercise. Yeah, Kegel exercise. But Kegel exercise is a big term. Squeeze your muscles. Okay, squeeze your whole pelvic floor muscle. But we have to be targeted into Kegels. Like which muscles we are targeting, like which muscles we are trying, we should increase the strength. So in this case, we should be increasing, our priority is the muscles around the urethra, urogenital muscles, muscles around uro area. Okay, so that is our priority. So we should be increasing the strength. This understanding you will get after the thorough detailed learning of pelvic floor. Okay, we will also teach you about assessing, how to assess, by taking a history and even the manual palpation, what sort of the muscle palpation should be in if the palpations are not there. So they need some kind of more detailed training. But yeah, you understand the concept that the muscles around the urethra, they are weak. If they are weak, they can't hold, they can't compress. When they can't compress, you can see that they cannot create a squeezing and urine will start coming out and leakage will be there. So now you understood when the muscles are weak, muscles are weak around the urethra and leakage is going on, urine leakage. So what is the training? Squeezing the muscle, increasing the power of the muscle. In short, doing the Kegel. Same thing happens around the other organ. So we say that this was the first organ, bladder, which is situated with the urethra and muscles are present all around that. Now the second organ, which is into the pelvic cavity in a female body, that is the uterus, our reproductive system. So this is our urinary system and this is the reproductive system. And into reproductive system, we all know that we have a uterus, which is present here. Do not do the sticky notes, please. So this is This is your uterus, and uterus is where our whole endometrial, all these menstrual things are going on. Are part of, it's very important part of reproductive system, where the framework will be developed, not framework, that environment will be developed for the better growth of the fetus. It is preparing itself by creating the endometrial wall formation, and a very important organ. Okay, and then we have fallopian tubes where that fertilization is going to happen. We have ovaries, two ovaries in our body. So these are the small ovaries present on the both side, and all ovaries are ovulating every month. So they are going to release egg. Egg will be here in the fallopian tube. Now the sperm will come into the fallopian tube and fertilization process is going to happen. We know this reproductive system. And if you want to have a one session about, free session about this, we can arrange even a free session just to make you aware more about that reproductive system. We can arrange it. Now, this reproductive system is having a cervix, and this cervix is going into, we can see into, that is kind of protruding, or that is open into the canal. And the canal which is attached with the uterus downward is an important passage. Like we have a passage, urethra, which is attached with the bladder. Bladder is the organ which is doing its functioning, and urethra is a canal through which this excretion is going outside. Same way, this is uterus, which is doing its functioning of the reproduction. And we have the other part, other system, canal. It's a passage, which is a vagina. So this is a vaginal canal, which is present here with the uterus. So this is a reproductive system, and I can place the reproductive system into the in correlation with the bladder. So look, so this is supported by the bladder, and uterus is anteverted, anti-flexion position, and they're lying on the top of the bladder. So it is not lying, so it is not behind the bladder, it is on the top of the bladder. Okay, very important. And what is behind the bladder? So this is a posterior wall, so behind the bladder is a vagina. So this is vaginal canal. So vaginal canal is again like a condom. It expands a lot into that perineal cavity. Okay, so it can expand. So depending upon what you are inserting a finger, you are inserting a vibrator, you are inserting a menstrual cup, you are inserting a penile. A penis can be with the different diameters, different length. So vagina has that kind of elasticity, which can, it can expand a lot, okay, according to whatever you are inserting. It has elasticity. You can stretch out, isn't it? You can stretch out this rubber. So you can stretch up to here, 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 here. So this type of elasticity is present into the vagina. So this is again the canal which is present here. Now, last part is the rectum. Rectum is the last organ which is lying into the pelvic cavity. So anterior is the bladder, middle is that this cervix with the vagina, reproductive system, and the last is that rectum. So we understand, so it's coming, the small intestines are there, large intestine is there, large colon, and it is ending from this through slightly left side, and it is going into the, it is attached here. So it's attached with the rectum. So stool will keep coming from this large intestines. They will have all this nutrient, absorption of the nutrient, and they will excrete the extra, which is not useful for the body. They will keep moving it through this peristalsis movement towards the this rectum. And rectum is again like a organ, which is like a balloon, which has to expand to create a filling. So it is going to filled up with the stool, the whole rectum. And the stool is collected into the rectum. Okay, so we know that. So this is its functioning. And this rectum has a canal. We are calling it as an anal canal. So this is the anal canal, which is the shortest canal into the whole pelvic cavity. It is around 3.5 centimeter long. So this canal, and you will not believe the muscles which is around the canal, external anal sphincteric muscle, external anal and sphincteric, like which is getting the compression. They are the strongest muscle, one of the strongest muscles of our body. Very good tone is there into those muscles. Okay, so you understood that we have a bladder which will fill up with the urine, and urine will go out with the urethra. We have a uterus as a female, excrete, the reproductive system will be there, and every month periods are coming and they will go out from the vagina. And the baby, if the growth of the baby is going on, that will also go out from the vagina. So the product will go out from the vaginal canal. And same way, we have this rectum, which is situated here, and this is going to go out from the anal canal, all these things. So urination, childbirth, or you can say that all the liquids are coming out from the vagina, secretions are coming out through the vagina, but expansion, in which cases expansion are going on during the sexual activities, even during the childbirth. So we need better flexibility around urethra also, around vagina also, even around the anus also, because the stool we have to pass. And we also want very better, so these organs are present. Assume that if I'm putting this organ in this, so we don't have any muscle here, so they will fall out. So this penile cavity, pelvic cavity is not complete. So the pelvic cavity is going to complete by these muscles present down there. Now in these muscles, let me place the organs one by one after another. So I'm putting the first organ here. Now I'm placing the second. Now we have a canals. Look, through that we have a space, and we call these spaces as the hiatus. So the organs are passing through. The canals are passing, not organs. They are also organ. Look, they are passing through that. The urethra is passing. Okay, then vagina is passing, and now at the posterior part, most posterior part, we have the anus. So let me put anus also. Okay, so these are the three organs in a female body. And let me just show you through the inferior, like that. So urethral opening, vaginal opening, and anal. So these are the three openings. These muscles are providing to the organs so the excretion can be done. And this is the levator and eye muscle. So what the levator and eye muscle is doing? It is supporting the organs, because organs are lying down. They are placed onto the levator and eye. So that's why we are calling the pelvic floor muscle is a supportive muscle. They support the organ. So anything happen to this muscle, levator and eye, which is on which the organs are placed, they can affect the organs. Assume this muscle is tight. If this muscle will be tight, so what will happen? They are going to create congestion here, because if I have a space, I have a space, and organs are lying. Assume that I have a tension. So the moment the muscles will have a tension, the organs will be under the tension, because they're attached with each other with the facial sheath, with the connective tissues, with the ligaments, even the muscle fascia. So something is touching me. So this is my levator and eye, and this is the organ which is lying on it. So if the levator and eye will be tight, so that tightness can go over that can create a tension over the organs. This is what we are saying is the pelvic congestion, or this tightness will not let the organ to expand, and patient can start having the congestion syndrome, pelvic congestion syndrome. So who will get congested here? All the organs and its attached structure. It will be ligaments, connective tissue, facial sheath. It might be nerves. It will be the blood supply, lymphatic system. Everything will be under the congestion. So in those cases, the organs cannot perform optimally, because there even the arteries, the blood supply is also restricted. And when the blood supply is restricted, you can understand the oxygen will not reach to the organs. And this is what the painful sensation. And when this kind of sensation is there, this kind of congestion is there, they will also pull the nerves. So nerves will keep sending signal to the brain, it's a pain. So this is what the pelvic congestion. So the muscles, which is, if this muscle will become tight, we don't want this muscle to be tight. If it will become tight, it will give pelvic congestion. So in this type of pain, congestion, should we give Kegel? Squeezing of the levator and eye? The answer is no. We cannot give Kegel in these cases. We cannot squeeze the muscles. So the target is release the muscle, relaxing the muscles down. So that kind of exercise, stretching, improve the mobility of this muscle should be our target. And we cannot improve the mobility by squeezing. That is we all know. It's very important to understand this concept. And so this is a levator and eye, which is a supportive muscle. So yes, and then let me attach other muscles are also with that. So let me show you like this. So you understood the function of levator and eye, deeper layer, and this is providing the support. to the organ and they are lying on it. But this muscle is downward part, middle layer and the superficial layer. Look, the organs are passing, canals are passing, okay, like this. 1, 2, and 3. Canals are passing, the organs are lying. So we know the first is levator and the second is the canals are passing through the middle layer or this superficial layer. So this is a middle layer compressors all around the urethra. Then we have middle layer of urethrovaginal compressor. They are also compressing around the urethra. Can you see this is the looping of the vaginal muscle? And then we have this external anal sphincter coming from all the way from here to down. This is external anal sphincteric muscle. So there are compressors around the organs. So if I want to hold urine, these muscles, superficial and middle, will contract. And pubovagina will pull it, but sorry, not pubourethralis. Pubourethralis will pull, levator and I will pull anteriorly. But compression will be around the urethra by the middle layer. Same way, compressors around the vagina will be by the middle layer. Same way, compression around the anus will be by this external sphincter. So this is the muscle which needs specific training. Urine incontinence, we will train this part. If in case of prolapse, because prolapse, your organs are falling outside. From where? Organs are falling outside from vagina. So we need compressors and the muscle should have a good strength around the vagina. So they are, so we have to train those muscles around the vagina. So vaginal compressors. Assume that female is not feeling good sex. She's saying that I don't feel anything inside. So when she don't feel the penis inside, the finger inside, 1 finger, 2 finger, 3 finger, that proprioception is not there. Vagina is, we call it as a vaginal laxity, but it's a pelvic floor laxity actually. Vagina is it has a tone. It don't squeeze. Okay. It can relax, stretch out, and it will come back in a normal tone. It don't create a squeezing effect. Vagina don't have that like voluntarily, or we cannot train vagina. That's a smooth muscle. But the muscles around that over here, the lower part of the vagina, this pelvic floor, they are the muscles which is creating a squeezing effect. So they will create the grabbing around the vagina. So they will grab the moment penis is going inside, the muscles are strong, they will grab the penis. The moment they will grab the penis will be, even the pubo-vaginis muscle part of levator and I, they will pull the penis towards the clitoris and female will have a sexual sensation. So we need a good muscles around the vagina. So how many muscles are present around the vagina? One is this one. The part of the pubococcygeal muscle, pubo-vaginis muscle is present. So let me put it this here. Can you see? So the muscles are, sorry, over here. So can you see muscles are looping around the vagina? So these muscles are pubo-vaginalis, pubic to vagina. So they are going to pull the vagina towards the pubic symphysis. And who is present here? Our sexual organ, clitoris. So the muscles are more strong, they will pull it and towards the pubic, towards the clitoris, and clitoris will get a sensation. So that is our sexual organ. We will get a good sexual sensation. We'll hit our orgasm also. But this pull is important. Not only the pull, the compression, the middle layer, the compression, they should grab the penis 360 degree. So that grabbing is also important. Just to have a better pull towards the clitoris. If I am that vagina, so I will be pulled by the first layer, deeper layer, which is pubovaginis, which will pull me anteriorly, and the middle layer, compresses, will also create a squeezing. So whatever organ is present, clitoris, assume the penis is there. So the 360 degree grabbing of the penis will be there. This is what we want. More proprioception the brain will get. And the outer is bulbo. So more externally, we have these muscles, bulbocavernosus. So what we want from the bulbo, we also want them to create action. So now bulbo is very, very important. What they will do, they will also create a compression and the whole system around the vagina will be compressed. And that will be, the squeezing effect will be there. And not only the squeezing effect, even the endurance will be also there. Till the time I want to have a sexual activity, 5 minutes, 10 minutes, 15 minutes, I want to engage into intercourse, the muscle should have a strength. They should have a good endurance. This is how they are going to complete the sexual functioning. They will help into orgasm. They will help into what we say is arousal state. They will help into penetrative state. They will help into orgasmic state. So this is very important that every state they are going to have. Note, so you can understand that we need a squeezing around the vagina. But if those squeezing is not there, the first issue female will feel is a low sexual sensation. So in that case, what should be our target if our female is telling? Squeezing the muscles, giving them Kegel, hold the muscles around your vagina. So what should be the command if the person is coming to us and like, okay, we have to give her Kegel, she has a low sexual sensation. So the command should be vagina. So we have to make her understand, okay, this is a muscle, this is vagina, and the muscles are present around the vagina. Try to close the vagina. So this should be the command. We will not give her a command, okay, squeeze your pelvic floor. No. Try to close vagina. So that should be the command. So more muscles around that area will get activated, get squeezed. So that is very, very important. Okay, so we can train those muscles by giving them Kegel exercise in case of low sexual sensation. And if patient has low orgasm, low sexual sensation, no feeling going on, so train those muscles, very important. Next, if, yes, we also understand that vagina is a central part, and this central area, this central vagina, you can say that anteriorly we are having bladder attached, posteriorly we are having a rectum, and sorry, like this is the organs. And on the top of that vagina, we have uterus, and downward, assume that, okay, these are the structure, and these are the pelvic floor muscles. These are the pelvic floor muscles, which is all around the organs down. Assume that this muscle don't have strength. If this muscle will not have strength, so vagina is a central organ. So what can happen? Muscle is weak and saggy. So when muscles are weak, saggy, so organ can start descending down. So they will not maintain their optimum position because they're lying inside. So if they're lying here into that part, and if pelvic floor muscles are weak, so what will happen? Weak means saggy. When it is saggy, it might start like displacing down. So gravity is also going to create more action. And every time, whenever we are standing, we are doing a sexual or a function activity, sorry. So this part is under the effect of gravity whenever you are into standing position. So gravity is the one factor which affect the muscles tone. It create a weakness into the muscle continuously. Okay, so that's why we say that we should not do lot of lifting against the gravity. Try to avoid, because that might weaken your pelvic floor muscle. So this muscle can get weak due to the gravity. And if this muscle is getting, there can be two factors. Into books, it is written that we don't know what is the factor affect the pelvic floor muscle is unknown. It is written there. We don't know what factors affect it, what create the weakness into that pelvic floor muscle, but I think we know the factor. The factor is the gravity, which is having the continuous pulling effect. We don't have any supportive bone and structures which can help us against the work against the gravity. Okay, and the second is continuously loading from the upside. Any activity which you are doing where your intra-abdominal pressure is getting risen up, that pressure is going to fall downward, and that is going to put pressure over the pelvic floor. And pelvic floor will, if I am the pelvic floor muscle and you are putting pressure, you are putting load on me, internal pressure is increased, so I'll go sag down. So continuously involvement in any activity where you are loading the area can give you weakness into the muscle. So obesity, pregnancy is important, but pregnancy, they are very important. Okay, as well as they are affecting the pelvic floor. Pushing something, lifting something, loading our body, holding the breath for a long time period. They all are the factor which can affect. Okay, pulling, pushing, loading, doing exercise, lifting heavy weights, and like, those factors like pregnancy and things like that, which is important for our body, they also weaken the pelvic floor muscle. They are the factor. And the gravity, whenever we are involving the gravity with our all intra-abdominal work. So either only the gravity, only the intra-abdominal pressure, or both. They are the factors which affect the pelvic. And on the top of that, we have other factors which can create a tension, and they which can create a weakness is a hormones. So because the muscles has a estrogen effect. So whenever the low estrogen level is down in our body, the muscle automatically will have a less tone. So hormone also has a effect on it, but mostly effect is that Aging processes, again, according to hormones. So aging process, hormones, they are important. They are the factors, but on the top of the abdominal pressure as well as the gravity, they affect the pelvic floor. So you can understand when the muscles will be downward, saggy. So who is the central part? Central part is the vagina. So through the vagina, there might be the organs will start descending out, and we are calling it as a prolapse. So in all the cases of prolapse, when the prolapse are coming from the vagina, that can be the prolapse of cervix, urethra, uterus, and intestines, rectum, any prolapse. So whenever pelvic organs, any pelvic organs are protruding outside, it means the space around that is weak. The floor around that is weak. So in this case, we have to give them Kegel. Okay, so I hope you understood. And same thing happens around the rectum. So we have muscles around the rectum. One is a puborectalis muscle, like the levator ani part, pubovaginalis, pubourethralis. Same way we have a puborectalis, which pull the rectum anteriorly whenever we have a collection going on to maintain an anorectal angle. We want that angle because we don't want stool to come and directly go towards the anus and load the anus. So we have a 90-degree angle between the rectum and anus, and we call it as an anorectal angle. This is created by the puborectalis muscle pull. Okay, and after that we have an external sphincter muscle all around. These muscles all wrapped around the anus like this. Okay, they are very, very strong muscles. You can see like this. Okay, the diameter, if you see around through the MRI, it will be around 3 centimeter, that much of big in a good cases. So this is and good fibrous arrangement also, round circular fibers. So you can see the compression. So whenever we are holding and we defecate one times in a day, the collection is going on throughout the day. We don't want the stool will come and leakage, passive leakage. We don't want that. The muscle should have that kind of tone. And but if the patient is having a leakage of stool, fecal incontinence, leakage of gas is kind of somewhere still controversial statement to give you that, oh, if the gas leakage is going on, the pelvic muscles are weak. No, it doesn't mean that. It can be other intestinal activities and other factors involved with it. But the most important is stool leakage. Okay, stool leakage, piles, because piles are these veins are present here into that area, and veins will be always get, if the pelvic muscles are strong, the many these anal veins are present at the anal region here. They are ending part. So sorry, not yeah, veins. You can understand that arteries are bringing the blood and veins are taking the blood back. So if the pelvic muscles are strong, that will compress this anus, and anal pressure is also high due to internal sphincteric pressure, and due to anal pressure, the veins will be under that compression. So the last part of the vein will get compressed. So if that is the squeezing effect is going on at the last part of the vein, so this squeezing is going to pull the blood back towards the heart. So this is going to increase the venous return. So more strong internal pressure, more strong pelvic floor, more better venous return, because that area is also kind of, I will say, it's the third heart of our body. So more squeezing, better venous return towards upside. So if the squeezing effect is not there, pelvic muscles are not able to squeeze the area, even internal sphincteric pressure is also very low, so that veins will not go, this venous return will be weak. And in this way, the blood will start staying into the veins. And due to the load of the blood, the might be veins will start coming outside, protruding outside. And this is what we are calling it as a what? Hemorrhoids, piles. Okay, and that can happen into any vein which is present into this part, upper part of the anus inside. This is the internal hemorrhoids, or outer part, external hemorrhoids. So you can understand the hemorrhoid and piles. The protrusion of the veins is what? Because of the weakness of pelvic floor. Okay, or stool leakage is because of the weakness of pelvic floor. So what we have to, in these cases, piles and hemorrhoid, what should be that exercise? Exercise should be Kegel, squeeze the pelvic floor muscle. But which muscle? Muscles around the anus. So in this way, we have to give the separate command to the person, try to hold your gas. So hold your pelvic floor is the wrong statement. Pelvic floor is the complete pelvic floor, okay? No, hold muscles around your anus. Okay, they might don't understand what is anus. They are laymen. So what we have to tell them? Try to squeeze your stool. Try to squeeze your muscles around the anus. Hold your gas. Hold your gas. Hold your gas. That will be very easy for them to understand. So now, how to do Kegel exercise. Squeeze your pelvic floor muscle. Is it the right command? No. The right command is depending upon what issues they are suffering from. I am suffering from urine leakage. So you have to tell me, okay, assume that you have you have to try to stop your urine. So assume stopping your urine. So if I'll assume, okay, the urine is there, stop, I have to stop it. But assume stopping urine is difficult for me. So what you have to teach me, okay, you can go use a washroom, and when your urine flow is going on, at that time, when urine is going on, flowing, uh, stop your urine. What you will do to stop the urine? So you might create some kind of squeezing inside. So do that squeezing. Try to stop your urine when it is you are urinating. So this way we will teach her how to stop urine. But this is not an exercise they have to perform, because urination is they have to go 6 times, 7 times, 8 times in a day. So we don't want them to train the brain, and we don't want to create incoordination into the whatever going on into the brain. Now, what brain wants? Brain wants to remove that whole urine. But what you are teaching? You are teaching them squeezing. So that's a wrong training. So we cannot use it as an exercise, but we can use it as a the first time education tool. Actually, you can just only educate them with this command. Okay, only for 1 and 2 times they have to understand what they have to squeeze. So do it, and after that, just assume that you are doing it. So assuming the hold your urine and hold it up. So how many seconds you have to hold? So that is again depending upon how much hold they can create. If they cannot, so Kegel is saying this is a limitation of Kegel. And I say one thing which is missing into Kegel is that, which I don't understand, is that if the whole, whenever the urine is, your muscles are weak, you hold them, you squeeze them and hold it for 10 seconds. As holding 10 seconds is not an easy task. If the muscles can't squeeze, how they will hold? So whenever muscles are not, assume that this is not able to squeeze my finger. When they can't squeeze, how they will hold? So this is, I think, something which my brain doesn't get about the Kegel. So that's why I'm not using Kegel. I think the Kegel has some kind of like limitation. So what should be the right things? Okay, strengthen the pelvic floor muscle around the urethra, squeeze. Try to squeeze, try to squeeze, try to squeeze, squeeze and hold, whatever time, 1 second, 2 seconds, 3 seconds. Hold, relax. Hold for 2 seconds, 1, 2. Can you do 2 seconds? Yes, relax. Hold again, 1, 2, 3. Can you hold 3 seconds? Yes. Okay, relax. So hold 1, 2, 3, relax. Hold 1, 2, 3, relax. Hold 1, 2, 3. First, she has to understand for how long she can hold. So hold it for minimum time, but maximum sets. Squeeze, open, squeeze, open, squeeze, open, squeeze, open. So all of you, shall we do the Kegel exercise? Do you want to practice the Kegel, or you want to practice that muscle squeezing around the urethra in case of urine leakage? Because urine leakage is the main complaint of a patient. So we will do, okay, let's start. Squeezing of your urethral muscle. So we are going to start, okay? All of you and me, please take a position. Assume the patient is suffering from urine leakage. Take a position, sit down. As a first command, I'm giving you, hold your pelvic floor. Hold your pelvic floor. Okay. I think you have done. Hold your pelvic floor.
I
Yes.
have a question.
Yeah.
When you said that get into position, so what position should we, assume a patient to be in?
Yeah.
Which position should we start in?
Yes, very good question. Yes, I'm telling you, take a position. So what position? And thank you so much for asking this question, because this is very important question. The first is depending upon weakness, and what position we should give our patient is depending upon the assessment. So for that, detailed internal assessment is important. That what is the strength of the pelvic floor muscle? But okay, if we haven't assessed, this is the person just came and I have to prescribe, because urine leakage is going on, I have to give her Kegel. So what do you think? Which should be right position? Do we want sitting position? If sitting position is there, so intra-abdominal pressure is downward, yes or no?
Yes, ma'am.
Yes. So do we want intra-abdominal pressure when we are doing the squeezing from down? Do you want load from up? Because you want to contract it up. So do you want load from up?
No,
The
ma'am.
answer is no. So sitting position is not good. So do we want standing position? So in standing, what is there? Gravity is also there. Internal pressure is there. So standing is no, no, big no. So no standing, no sitting. So what is the good position then? Lying down.
Lying position.
Okay, so lying down is always good position to start the Kegel because we don't have intra-abdominal pressure and we don't have even that gravity. Okay, is it a semi-lying position or is it a pillow or just a small pillow at the back? Small pillow at the under the head, just a small pillow and no gravity, no intra-abdominal pressure rise. Clear, everyone? This is a starting position, and we will progress slowly when the holding capacity will increase. Then slowly we'll progress in sideline position, then we'll progress in left sideline position, then in prone position, then quadruped position. When person will be able to do perform this squeezing for up to 10 seconds in all these positions, then we will give them pelvic bridging. Then we will add different activities, like for example, pelvic squeezing the pelvic floor and doing the pelvic bridging together. Then adding that, this is what we are calling it the progression of the Kegel exercise. So you are squeezing with the different more muscle use. So you're squeezing the pelvic floor. So that's a one muscle, pelvic floor, which you are creating action. And with that, you're also adding the pelvic bridging. One movement is added. So that squeezing with the pelvic bridging. Squeezing with adduction. So tell the person, okay, do adductors with squeezing the pelvic floor, double squeezing, squeezing with glute squeezing, squeezing with abdominal squeezing. So means training the core muscles with the accessory muscles around the core with the pelvic floor, because this is the pelvic floor which is present here. But we want all accessory muscles to get involved one by one. So first we will involve glutes, then we'll involve the adductors, then we'll involve abdominals, then we'll involve the abdominals and adductors, then we'll involve the abdominals, adductors, and glutes. So this is a kind of progression of more using of more muscles. Only not only the pelvic. With the pelvic floor, you are also using me. With me, you are also using other person. So everything will be trained with the pelvic floor. Okay, so this is how the progression of the positions: supine, then you can say crookline, then you can go for, so first should be elevation of the hip. So put the pillow under the hips and elevate it. So internal pressure will be also go back. So elevation of the hip, crookline position should be the first starting position of doing the Kegel exercise. And then you can progress by removing the pillow. And then you can progress by going in sideline position, other sideline position, prone position, quadruped position, and then slowly onto sitting. Then you're adding all the exercise, different muscles as well. And then into sitting position, then into sitting also, like forward sitting, backward sitting, sideways sitting. You have to kind of do action in every position, and then into standing. So standing, then squats, lunges, front lunges, backward lunges, everywhere, like including the gravity, because always we are doing with the gravity all exercises. So this is the progression of exercises. Okay, dear?
Yes, ma'am. Thank you.
Okay. Now, uh, let's do Kegel, all of you. So better is that if you lie down, but if you are also sitting, it is depending upon you. You have to feel your muscles. My first command to all of you is do Kegel exercise. This is the first command. Can you understand that? Do Kegel exercise. So Kegel, oh, where I have to do Kegel? Wherever you do the Kegel exercise, squeeze the pelvic. Do your Kegel. Okay, second command I'm giving you, relax. Squeeze your pelvic floor. Oh, squeeze your pelvic floor. Ma'am just said there are so many muscles. Which muscle I have to squeeze? Still brain will be confused, will not get. Squeeze your pelvic floor. Okay, relax. Can you assume from where your urine is coming out? Urine is coming out. Assume that you have to stop your urine. So hold your urinal part. Hold your urinal part. Hold your urine. Hold your urine. Relax. Don't hold, huh? Don't hold for a long time. Just squeeze around the urethra. You have a urethra. from where the urine is coming out. Can you squeeze your urethra? Relax. Can you squeeze your urethra? Relax. Squeeze, relax. Squeeze, relax. Squeeze, relax. Okay. Can you squeeze around your urethra and hold it for 2 seconds? 1, 2, relax. Squeeze around your urethra, hold. 1, 2, relax. Squeeze around your urethra. 1, 2, relax. Squeeze around your urethra, 3 seconds. Hold. 1, squeeze, hold. 1, 2, 3, relax. Relax, 3 seconds. Again, squeeze around your urethra and hold for 3 seconds. Squeeze, hold. 1, 2, 3, relax. Again, around your urethra. In your mind, close your eyes, squeeze, and hold. 1, 2, 3, relax. Now, out of these 3, do Kegel exercise, squeeze your pelvic floor, or hold urethra. Which command is good? You felt more contraction. Which you feel more, giving you more understanding, and where the more hold and squeezing you felt? Anyone of you?
Hold urethra.
Hold urethra. Which one? You can write down. Out of the stop P. Very good. Stop your P. Hold urethra. So we need to understand what the layman will understand. Layman understand the word P, urine. So we have to use that word. Okay, hold your P. Hold your P, relax. Hold your P, relax. Hold your P, squeeze, hold your P. Hold it for 2 seconds. 1, 2, relax. Hold it for 3 seconds. 1, 2, 3, relax. So this should be the Kegel exercise for the person who is suffering from urine incontinence. And if the person is suffering from prolapse means from where the prolapse is going on. Prolapse is going on in a female body from the vagina. Organs are falling outside. So our focus should be vagina. So we have to show them that there's a space between the urethra and the anus. We have another part. Vagina is there through which you do sex, through which we are inserting the finger, the gynecological examination. You might have to show them the vagina through these anatomical pictures. If you have any printout, show them that this is a part we are talking about. You can show them through this sort of models that we have. This is the pelvic floor muscle and this is your vaginal part. So show them, educate them first. Education is very important. Or they can even touch. They can touch all of you. Can you put your finger, if you are at a comfortable place, around your urethra? From just you are into don't remove your clothes. With the clothes on, just try to palpate urethral part. You will feel, oh, this is from where urinal sensation is there. And downward also, you can put your finger around the anus also. Same way, we have another part around the vagina. This is a part. And we can show them that you have a prolapse coming out from here. So mirror biofeedback. You have to show them into the mirror. Look, your organs are hanging from here. If prolapse is going on. So you need to close the door. Assume that you have a door around the vagina and close the door of vagina. So there are 3 commands. Do Kegels. Okay. Squeeze the pelvic floor. All right. Close the door. Assume that you have a doors around the vagina, curtains around the vagina. Close the curtain. Relax. Close the curtain. Relax. Hold your vagina. Relax. Close the curtain. Relax. Close. Relax. So this is the right command for the person. Assume you have a curtain and close the curtain. Close, relax, close, relax, close, open, close, open. Okay, close, hold. 1, 2, 3, open. Close, hold. 1, 2, 3, open. So this is the command for pelvic organ prolapse. And if the person is having low sexual sensation, the same command will go in this case also. If the person is having a stool leakage going on, so stool leakage is a passing of passive leakage of the stool. So in that case, there are 3 commands. Do Kegel, hold your pelvic floor, or hold your gas. All of you assume that we have a area from where the stool is coming out. You are passing the gas. Assume you are into the meeting and you cannot pass the gas here. So what you will do? Hold the gas. So all of you hold gas, relax. Hold gas, relax. Hold gas, relax. Hold gas, hold it for no, squeeze. Yeah, hold gas, hold it for 2 seconds. 1, 2, relax. 2 seconds. Again, hold it for 2 seconds. 1, 2, relax. Again, hold it for 2 seconds. 1, 2, relax. Again, hold it for 3 seconds. 1, 2, 3, relax. 1, 2, 3, relax. So can you understand and which command will be good? Hold your pelvic floor, do your Kegels or hold your gas. Hold your gas will be the right command for the layman. They will understand that because they are doing it. Then their brain understand this. Okay. Or hold your gas, hold your stool. They will understand that thing. Squeeze it. So this is the Kegel exercise, and still we don't know that our person who is sitting in front of us, they are doing it or not because they have the clothes on. So as a therapist, will not get to know that they are doing it in the right way or not. The studies are saying that 98.7% people are doing the Kegel in a wrong way. Yeah, of course, because the concept is quite big concept. It is not a kind of targeted exercise. So we should have something targeted exercise. So then the concept should be, okay, squeeze a pelvic floor. No, that is again not a good concept. The concept should be individualized. The command should be according to whatever is going on, what they can understand. So squeeze your urine for urine leakage, close the curtains around your vagina in case of prolapse and the sexual activities, low sexual sensations. Around that anus, hold your gas. That should be the right command. Right command, brain will understand in a better way. But he or she is doing right or not, how we will understood. As a therapist, there's another technique for that because we can see that muscles are coming from front to back. So you can assume as a therapist that when they will be squeezing, so what will happen to the pubic symphysis and the coccyx? If they will squeeze and lift it up, so what will happen to these two bony prominences? They will they will come together or they will go away from each other. Squeeze. So what will happen? What should happen? Come together or go away? Anyone of you write it down? Come together. Yes. So this should be the action. And what should be the action from this to ischial tuberosity? If they're creating squeezing, what sort of movement should be there around ischial tuberosities, right and left? Closing, coming together, or going away? Ischial tuberosity, come together or go away? Come together, right? Together. Okay. Now let's feel. You can put your middle finger at what side of ischial tuberosity? The sit bone. And other side of ischial tuberosity. Assume I am the patient and you are putting your hand below my sit bone. So put it there. Feel my sit bone. All of you do it with me, huh? Do it with me. We are just finishing, dear, within 2 minutes. This is last moment. Okay, feel that ischial tuberosity and sit down. This is only, even into supine also we can feel. So feel it. Are you ready? Yes. Okay. Feel it. Done. Okay. Now just relax and hold your gas. Relax. Hold your gas. Hold, 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 hold. Relax. Hold your gas and relax. Hold your gas and relax. What did you felt around ischial tuberosity? Holding the gas, coming together or going away? Any moment did you feel? Together. So The person is doing the right Kegel or not. How to assess? Put your fingers around the ischial tuberosity, tell them to squeeze, hold the gas, hold urine, and close the vagina. They will come together, and we can literally feel the palpation that they are coming together. When they're coming together means they're doing the right action of the muscles. And the same time, this is the right Kegel, this is the right activation of the pelvic floor, this is the right way to create a squeezing in the effect into the pelvic floor muscle. And they will squeeze and then relax, squeeze, relax. So you have to feel the squeezing and the releasing. And yes, this will be the right exercise. And as a therapist, we will also get to know, yeah, they are targeting the right targeted muscle is active. And this, we can also see that when this movement is going on, is there any action around the adductors, around the glutes, and squeezing of the glutes is going on, and abdominal activity is going on. So we will tell them, no, don't use those muscles, because those muscles are not our target. We are not activating the abdominals and glutes and those. We are strengthening the pelvic floor. So into that part, only pelvic floor should be active. Don't use the accessory muscles. So, and we will feel that in their action. They will just lift up, they will squeeze that abdomen. The squeezing will be visible and palpable. So we'll tell them, no, don't squeeze. It's just, if you are doing the squeezing of that, you are targeting the wrong, you are activating the wrong muscles. Let's activate only this muscle. Okay. So this is the right way of doing right pelvic floor strengthening around whatever case is there. If there's a urine leakage, so the command is urethral muscle squeezing, and focus will be there. Brain will also understand that. If it is an anus, so we'll understand in this case of urinary incontinence. If it is a sexual issues and reproductive issues, or it is a kind of prolapse, then it will be vagina. So this is the right Kegel. So this is the Kegel exercise, and so the someone is returned that, ma'am, how we will teach the reverse Kegel. So reverse Kegels, whenever the patient is complaining that I have pain into this region, I have pain into touch, sensation, into penetration, inside the vagina, sexual pain is there, perineal pain is there, pubic pain is there. Pain is the first problem of the person. And voiding difficulty. I can't pass urine. I can't insert inside the vagina. I can't pass stool. So kind of some voiding dysfunction, defecation dysfunction. Okay. In this case, is no Kegel. It is a reverse Kegel. So now what we have to do, in that case, we need a gravity, isn't it? So give her positions where the gravity can have a stretching effect over the perineum. So gravity assisted exercises. And the second is the sitting is also good. Standing is also good in those cases. Squatting is also good positions. So give them activities and the positions where the gravity and intra-abdominal pressure can always put internal relaxation of the pelvic floor. So balloon needs to expand. So whenever the balloon will expand, you will hold the breath inside. So balloon is going to expand from all the side, even downwards. That is going to help into stretching, putting stretching and load. That's going to help into putting load over the pelvic floor. So this part will get loaded when you are going to hold the breath. So when it will be loaded, so stretch will happen, the downward stretch, and then the gravity assisted positions. They are the good positions. And so load the pelvic floor as well as the stretching, use that gravity. So this is the position, and means what we want in this case. Squeeze, no, we want release. So try that, assume that you are passing the gas, assume that you are urinating, assume that you are throwing something out from the vagina. So open, don't squeeze, no Kegel, reverse Kegel. So you might have felt that the palpation of your ischial tuberosity, they were coming closer and going out, coming closer, going out. So closer and hold 1, 2, 3 was our target in kind of weakness. But in the relaxation, when the muscles are tight, our target is squeeze, relax. So relax should be more focus. Relax, so movement away. So any position, any exercise which moves pubic symphysis away, so more mobility into the pubic symphysis, more mobility around SI, more mobility around the ischial tuberosity, adductions, lot of abductions. external or internal rotations. They are going to help into relaxing the bony part, the muscles which is attached with the bones. So we will take care that adductors and all accessory muscles are relaxed. They don't have a spasm. After that, pelvic floor should be downward pressure over the pelvic floor, or ischial tuberosity should move away from each other. Uh, Release your gas. Assume that you have to release your air. Release your gas. Remove your, so just pass, you assume that you are passing the urine. Assume that you are throwing something out from the vagina. Ischial tuberosity should not come together. They should go away from each other. This is the reverse Kegel. So I hope that you understood the concept. Neha is asking, in hemorrhoids, one should focus on reverse Kegel. No, no, no. Hemorrhoid is the issue when there's no pressure over the veins. The pressure is minimized, means contraction ability is not there. So we need to increase the contractibility of the muscle. So hemorrhoid is the issue which is going on with the weak pelvic floor. So we have to focus on the Kegels in case of hemorrhoids and PUTs. Yeah, if hemorrhoids are painful, so it is a kind of mixed pelvic floor condition. Pain is also there and organs are also protruding out. So mixed pelvic floor. So in this case, we will not focus on to squeezing and releasing. We will focus into fast twitch muscle activity, circulation, squeeze lax, squeeze lax, squeeze lax, squeeze lax. That will be the right command in case of hemorrhoids. Squeeze, 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 fast twitch action. If we have to give reverse Kegel in case of constipation, how we will command and proceed? Constipation is again is a big term to understand, because the constipation can be because of the food you are eating. It might be don't have tight stool you have, not tight like a dry stool you have, big stool, dry stool. So that can also be a reason of constipation. But in this case, you need to first assess the status of the muscle. If the muscles are tight, then only you can relax them with your finger. There are many releasing techniques for that. I will suggest you. This is a simple, today's webinar was a very simple webinar about 1 hour, which we have already exceeded up to 1.5 hours. Today's webinar was just giving you understanding what should be there, instead of only focusing on Kegels and what mistakes we are doing. And so I tried to give you a bit understanding about Kegel today. But pelvic floor, this subject is very vast subject. It's like ocean actually. The more you dig in, because I'm also practicing since many years and still I'm learning. And every new case is going to teach you something new. Okay, so please, if possible, Google is available nowadays. We have AI also, and now you can also you can read the scholar articles. You can read some kind of publications more about the pelvic floor. You can buy some books, read from that, or there are many sources. Or just simple, you can enroll yourself into some online courses and offline courses. They are not very expensive also, they are very cheap. So you can take online recorded videos. If you don't have time to join into live sessions, you can buy the videos and you can view as your comfort. And you can finish the learning. There are videos, recorded videos are there with us also. You can buy from us. And you can join us into hands-on learning programs about pelvic floor. The pelvic floor is not only about the female, there are also male pelvic floor, like erectile dysfunction issues are there, premature ejaculation is there, the prostate, the issues going on with that pelvic floor muscles after the hemorrhoidectomy, prostatectomy, and then we have a prostate inflammation. So many issues are affecting the female. And you can definitely learn about female pelvic floor rehab or male pelvic floor rehab according to your choice. And because some system is different in male and female, but please learn through the books and learn through some kind of compile videos or compile kind of workshops. Okay, someone is asking me, and I was expecting that why someone hasn't asked this question to me. If I made Dr. Sunita in Kegel, breathing or squeezing, so what is the correlation of the breathing with the pelvic activation? So thank you so much, Dr. Hernards. I'm sorry if I'm not spelling your name correctly, if I'm not pronouncing it correctly, but it is a very good question to be asked before ending this webinar. what sort of breathing we have to do when we are doing the Kegel exercise and we are performing the pelvic floor exercise. So now simple pelvic floor is like this and abdominal diaphragm is also like this. Okay, so the both are moving into the same plane. So if you are doing up, they will both will go up and down. So what is going on? So up means you are exhaling. So during exhale, your abdominal diaphragm will go up, your pelvic diaphragm will also go up. So they will be upward, up into exhale. So now, any case, when you want to create a squeezing, what you are doing, upward movement of the pelvic floor. So when you're doing upward movement, so your abdominal will also go up. So what should be the action? Exhale. So exhale when you exert. So what we are doing, we are exerting the muscles. We are exerting the pelvic floor, squeezing the pelvic floor. So exhale when you squeeze. Okay, or inhale when you relax. So in case of Kegel, we have to focus on exhale more. And in case of reverse Kegel, we have to focus on inhale more. So just a simple thing, inhale from your mouth, air will go down, thoracic, abdominal, diaphragm will go down. That will put a pressure over abdominal organs. They will go down. They will put pressure over the pelvic floor, pelvic organs. They will go down and pelvic floor muscle will relax. So because that is a downward pressure going on. So inhale is expanding. So means releasing down. The pelvic floor will be relaxing. So inhale is a relaxing. So that is important exercise, the correlation when you are doing reverse Kegel. So any painful situation, defecation, urination difficulty, penetration difficulty, focus on inhale more. Okay. And whenever you have a leakage issue going on, you are focusing on Kegel exercise and you are doing that kind of squeezing, squeeze your pelvic floor, hold your pelvic floor, or hold your urethra. So hold urethra means squeeze. The moment you will do squeeze, that the pelvic organ, so squeeze, the pelvic organ will move up. That is going to move, put pressure over that diaphragm. That will move up, and you are doing exhale. You are exerting. So exhale when you exert. Exhale when you are squeezing, and inhale when you are relaxing. Okay, so this is a very, very good question. Please, conclusion of, can you mention some male problem? Yes, doctor. Male urine incontinence is common in both male and female, and urine incontinence is more common after having your prostate removal. 80% of the people who remove the prostate, they have more urine leakage. Why? Because the urethra was passing through the prostate. Urethra was getting support from that prostate. The moment you will remove that prostate, urethra will not get support. Okay, and when they have a complete hemorrhoidic, this prostatectomy, they will remove this organ. They will remove this part of urethra also, and after that, the outer part of urethra, they are going to do stitch. They are going to stitch with the internal bladder. Okay, so this is the 360-degree new kind of urethra is going to now like attached with the bladder. So stenosis is going to develop. And you can also understand when they are stitching the urethra with the bladder, the nerves, arteries, all the supply lymphatic system that's going to get disturbed. And even the pelvic floor muscles, which is attached with the prostate, they will also. So the prostatectomy can be the big issue, which is going to give and as well as which is going to give them weakness, leakage issues later on. Okay, so that is a prostatectomy, prostatitis. When the prostate is inflamed, that will not let the urethra to relax, and urine, you can't pass urine, and it will be painful urination, and urine will be start getting filled up into the bladder. Overflow, incontinence is the issue which is affecting more into male. Okay, because of the prostate health. So prostate health has a direct effect over the bladder health. And second is erectile dysfunctions, because the muscles are attached around the penis. If I'll show you the penis, so this is the penis of a male, and the muscles are attached with the penis like this. Can you see? This is the penis, and the muscles are present at the base of the penis. This is the legs of the penis, and this is the body of the penis, and this is the base of the penis. So complete base of the penis is attached with these muscles, bulbocavernosus. They're like a ring. If these muscles, pelvic muscles are weak, so they will not, if these muscles are weak, ischiocavernosus we are calling, which is all around the legs, they are weak, so they cannot create a contraction. And beneath these muscles, arteries are going on, which supplies that penis. So for the erection, we need more blood circulation, more blood to pump up. But if these muscles are weak, they fail to pump up the blood towards the penis. So the blood will not reach towards the these chambers and they will not get filled up. So we want strong pelvic floor muscles for the better blood supply towards the penis. We have male has many chambers, empty chambers inside the, we call it as the cavernosas. Okay, so we need to fill up those cavernosas with the blood. Okay, so if this ischiocavernosus muscles is weak, you can't fill up those and they might be weak. And after that, when the blood is filled up, we don't want the blood to drain out. We don't want it drain out because they are coming. They should stay there. Blood should stay there, not draining out. For this, we have these strong muscles, bulbocavernosus at the base of the penis. 360 degree, they are creating, they are behaving like a ring. And they will compress, contract, and due to better contraction of this muscle, blood can't go up. So that muscle is important for erection. This is ischio is important for erection, and this bulbo is important for sustaining the erection for longer time period. More better bulbocavernosus muscle, more stronger bulbocavernosus muscle, more better, stronger and long-lasting erection. So this is the pelvic floor muscles, which is very important for male. And now studies are showing that 40% of male after 40 years are suffering from pelvic floor, from erectile dysfunction. So you can understand erectile dysfunction. There can be many reasons. It can be the weak heart, weak capillaries, kind of stenosis into capillaries, even some system effect into the circulatory system effect. Heart health is not good. Okay, or some kind of medications. If you are diabetic, you are taking some medications, which is medications are relaxing your body. So they also relax these muscles, they relax your veins. So the venous health is also, the walls inside the veins are also relaxed. So it might be because of the arterial effect, it might be because of the venous effect, it might be because of that pelvic floor, okay, or some medications you are using. It might be because of the weakness of the pelvic floor. So erectile dysfunctions, premature ejaculation, you are ejaculating before the time. So premature ejaculation is going on again because of the pelvic floor muscle weakness. Pelvic floor muscles can be one important factor in that. So prostate health as well as that erection issues, premature ejaculations, they can be issues of male can suffering from pain, penile pain. Yesterday only I got a call from one patient who's suffering from testicular pain actually. So testiculitis, scrotum inflammation. So those kind of things can give pain into that area. And because we have a facial and this muscles connection, the pelvic muscles can go into spasm in those cases. Okay, so pelvic pain, pelvic congestion pain is very common in male after certain age and due to certain, whenever these inflammations are going on around the scrotum, prostate, around that testes, and they can affect it. Infection is not that common in male, okay, but UTIs are not common in male because they have that kind of angulated and long urethra. So, and they have very protected environment inside. Which is very common into female. And then hemorrhoid and piles are too much in male. 80% of male, they have hemorrhoid and piles. Females they are also having hemorrhoid piles. Whenever we are getting pregnant, our sacral pressure is more and they can give us hemorrhoid, but that is also a problem, which is male are suffering from hemorrhoid and piles. And constipation is again, a very big issue. And in today's webinar, I think I covered everything except giving you that correlation of the pelvic floor with the whole core, okay, and how it is impacting the back health. You can understand whenever the muscles are present here, if they are strong enough, they will maintain that whole pelvic in the right position. So you can understand when the muscles are saggy and loose, so loose muscles will not be able to bring the ischial stability. So the pelvic bone will not get stabilized if these muscles are weak, and stability can affect that positioning of ischial tuberosity. They might come closer to each other. They might go away from each other because the strength pulling them together is not, the strength is not there. Then the ischial tuberosity will go away from each other. So you can understand. And this ischial tuberosity will not be maintained in a right position. that is maintained by a good pelvic floor. When the pelvic muscles are saggy, ischial tuberosity will go away from each other. The moment they will go away from each other, you can see there's a distance between the sacrum and ilium. So SI joint pain will come. So back health is 100% correlated with the pelvic health. So if the muscles are strong enough, there will be no issue going on with the SI. But whenever the saggy muscles, you can see the muscles are, the SI joint pain and back pain can come. When the muscles are tight, look, as over tight, again SI joint pain. So we don't want over tight muscles, back pain will be there. Tight, loose muscles, back pain will be there. So this is the kind of correlation between the back health and this, and that you can understand if it is affecting the sacrum, SI, the muscles touch there, how it will affect the lumbar muscles, how the load will go into the side, the internal and external obliques, and how it will transfer on the transverse abdominis muscle, and how it will affect the anterior rectus abdominis. The whole core is joint and correlated. Complete mechanism of that core will be now weak if you have a weak or tight pelvic floor. So that is going to affect the core. So for that much of detailed understanding, if you want to know, you can definitely join me into live sessions. And you can, if you can't join into live sessions, you can definitely get that recorded sessions and watch at your own comfortable time period. And whenever you have time, and please, this is a time, high time, that let's start addressing the patient who are there into the community suffering from the issue related to the pelvic floor. I want to take you again to my PPT. Okay. Let me share my PPT because this is very important. Just quick revision. So you know now what is that, who invented the Kegel, and you also know that it is very important, the pelvic floor muscles, which is present here in a male and female, and through which the canals are passing. And this is important. These muscles are providing a good base of support. And you can say that these are the different organ in male and female. And then the organs have their own structure like ligaments, fascias, facial sheaths, everything. And organs are positioned in a right place by, into the pelvic cavity. And pelvic floor is a good floor, which is supporting the organs. And the function of the pelvic floor is supporting the organs, providing the stability to the complete bone, pelvis, sacrum, as well as the core, sphincteric action, closing and opening whenever we required, sexual functioning, like it is the good muscles will give you better orgasm, better penetration without any pain, and better sensation to the brain, and you will go for sexual activity again and again if you like it. And circulation, better circulation is also important. Okay, good pelvic floor, which can have a good tone. If the tone is too high, we call it as a hypertonous pelvic floor. If tone is too low, we call it as a hypotonous pelvic floor. So these are two type of conditions. Many factors can affect the pelvic floor issues. It can be the reproductive system, that hormones which is there, that can affect. Loading yourself a lot can affect. Lifting a heavy weight can affect. Falling, surgeries, obesity, severe COPD conditions, like straining during the urination and defecation, and aging process. They all affect the pelvic floor, as well as the pregnancy, childbirth, and damage which is going on during the childbirth. You can see the perineal muscle can get separate when the baby is coming outside. And so perineal tears, episiotomy, there are many cut into those muscles. So that can give you healing. Healing can give you scarring. Scarring can give you adhesion formation, and that can restrict your entry inside the area. The muscles can be weak, tight, as well as weak, both. And so there are three types of dysfunction. One is a hypotonus, when muscle has loose, saggy muscles, no tone. That type of muscles can give you issue like urine incontinence, pelvic organ prolapse, anal flatulence, fecal incontinence, decreased sexual sensations, piles and hemorrhoids, and erectile dysfunctions, premature ejaculations. Those kind of things can come into hypotonus dysfunction. In all these cases, we have to give them Kegel exercise. In case of hypertonus, when muscle has a high tone, and tensed muscle, shortened muscles, spasmodic muscles, they can give you chronic pelvic pain syndrome, pelvic pain, interstitial cystitis, vulvodynia, anismus, dyspareunia, pudendal neuralgia, constipation, tension, and tightness. Okay. And so this is a hypertonus. You have a difficulty in passing the stool, passing the urine, having the sexual activities, inserting inside the vagina, no penetration, painful sex, deeper pelvic pain, those kind of things can come into this part. The third is a mixed. It can be some part is a hypo, some part is a hyper. For example, if you are constipated, your muscles around that area can be tight, and when you are putting a lot of strain, that can create a weakness into the anterior muscle because you are putting a downward strain continuously every day. That can be the cause of creating a weakness into the other muscles. Okay, so that case we are calling it as a mixed, like piles and hemorrhoids. So hemorrhoids, when they are painful, when they have a blood coming out, painful hemorrhoids, you can say that is a mixed kind of issue. Okay, and any surgery, like whenever we are using any kind of stitching, suturing, kind of incision, that can lead to adhesion and scar tissue formation, and that can create a shortening into that part. So they can again create issues like some nerve damage, some muscle damage. If that is going on, so control will not be there, and as well as development of stenosis, anal stenosis, urethral stenosis, vaginal stenosis, when we have a chemotherapy, radiation therapy going on in case of cancer, treatment. So they all can affect, any penile surgery can affect that area and create a tension. And it is not only the tension, even the weakness can also come into that area. So mixed type of pelvic floor issues. We know that exercise therapy, like we understood today, that strengthening is a Kegel. Whenever we need a strengthening of the muscle, Kegel, or whenever we have to create a stretching on, that's a reverse Kegel, releasing the muscles down. So that's the release, that's the reverse Kegel. So next is, electrotherapy modalities, which we are also using. Manual therapy techniques are also there. Like perineal massage, stretching, some invasive, non-invasive, myofascial and trigger point release with our fingers, and even by use of some tools, dilators, vibrators, perineometers, those kind of pelvic floor tools are also available into the market, which we are using, teaching them the right contractions, that is the right squeezing of the pelvic floor, Kegel exercise, teaching them the right relaxation, like reverse Kegel. Take a screenshot of this image, please. You will, you can read whenever you have time. I have already explained. And breathing role is also very important. I told you that during exert, when you exhale, when you exert. So this is a simple concept which is applied over the pelvic floor also. And not only that squeezing and doing the Kegel is important, proprioception is the first thing, the biofeedback is the first thing the brain understand. So we have to use some tools which can give the proprioception to the person, touching the area, touch the vagina, touch that urethra, touch with your finger, touch the anus, external part with your finger. Don't insert, just touch. So touch is going to give a better proprioception. Brain will understand, and you can also see that you are touching and see that into mirror. So mirror biofeedback. Your brain will also get, okay, you are touching this area, and I have to create a squeezing. So that is going to give them the better squeezing and relaxation of that area. So Kegel is not complete without the proprioception. This is what I believe. It is not written anywhere, but I believe that the effect of the squeezing will be more good when you add proprioception with them. Yes, in these are the conditions where who needs pelvic floor? Everyone needs pelvic floor. Specifically into pregnancy, after childbirth, after C-section, having the people who are obese, any surgery happening to that area, they need pelvic floor. Aging process, muscles can get saggy, they need pelvic floor. If you are involved into excessive straining while pooping, suffering from constipation, chronic coughing, you need pelvic floor. The person who are involved into the jumping, running, lifting heavy weights, in all sports activity, we need pelvic floor. Patient who are already having the issue related to the bowel, bladder, and the area downwards, if their muscles are weak and they have some kind of surgeries, and after effect of the sudden fall, trauma, they need pelvic floor. If already you have the symptoms, you need pelvic floor. The sports training, pelvic floor should be important part, because we are training everything except the pelvic floor. So I have seen many sports people, athletes, people who are leaking, who have a prolapse. Many cases I have seen in my life. And as a physiotherapist, you need pelvic floor because we are involved into loading the patient on our body. So our pelvic floor is mostly weak. This is what I'm telling you. It is not written anywhere. This is what I'm telling from my experience because I have trained so far more than 15,000 therapists in my life. And I have taken hundreds of workshops. And in those workshops, always there is physiotherapist, and 50% of the physiotherapists, they have pelvic floor issues. This is what is my, my palpitations are telling me. Yes, research is saying that, yes, we should accept Kegel, but the right way of doing Kegel. And it is an evidence-based exercise. So I think from today onwards, we should not use the word Kegel. We should use the word pelvic floor strengthening exercise or pelvic floor relaxation exercise. So Kegel is the pelvic floor strengthening exercise. Okay. There are many tools which we use into the pelvic floor: perinometer, electrical muscle stimulation inside the vagina, inside the rectum in case of male, inside the vagina and rectum both in a female. Dilators are there to increase the dilations whenever we have a painful insertions. Pelvic vents with the vibrators to release the deeper muscles, superficial muscles, vibrators, vaginal weights for the strength training, endurance training. And not only this, we can use our ultrasound, TENS, IRR, the equipments which we already having in our physiotherapy setup. Like if you have a ultrasound, if you are having IRR, if you are having TENS, IFT, all these equipments we are also using into pelvic floor. And it affects both male and female. These are the conditions. Please take a screenshot and please add this patient in your clinical setup. Why you are not treating them? Who is suffering from urine leakage, painful urination, constipation, piles, fecal incontinence, sexual dysfunctions like low sexual sensation, erectile dysfunction, some medical conditions which affect them, like whoever is diabetic, hypertensive, they are having cancer, their pelvic floor is always affected, erectile dysfunction, premature ejaculation, endometriosis, pelvic organ prolapse, uterus tilting, repositioning of the uterus, pelvic period irregularities, vaginal dryness, UTI, sexual pain, tightness of structures due to chemotherapy, removal of uterus due to some conditions, coccydynia, back pain, postural issues. Everywhere the pelvic floor is affected. So why not to add this patient in your clinic and even increase your inflow of money? Okay, you can charge them. And these sessions are 10 sessions, 20 sessions, 30 sessions, might be 1 month, 2 month, 3 month. They need treatment. And so why not to add this patient in your treatment? Okay. And this is a statistics in India. You can look into Philippines, in Malaysia, other countries also, if you are joining me from them. Urine leakage is affecting 42% people. Hemorrhoids in piles is affecting 50% of people. If you are not treating these conditions, you are missing a lot of patients. And you can add pelvic rehab in your, you can learn pelvic rehab, you can understand this muscle and start treating the patient who are suffering from urine leakage, hemorrhoid piles, pelvic prolapse, vaginal laxity, female sexual pain, female sexual dysfunctions, post-operative pelvic pain, constipation, stool leakage, erectile dysfunction, vaginismus, dyspareunia. These are the conditions which is affecting the people, and they don't know where to go. They don't have any solution, and they just live with the conditions. And there are references which I have taken into from India, but you can find out in your country. 52% of the female athlete, they have leakage. 49% of people who are athlete, they have a chronic back pain. So that you can understand the pelvic floor is related, and the person is suffering from chronic back pain, definitely they will have a urine leakage also. Yes, pelvic floor dysfunctions are very common, very common. You have seen this, but they are not normal. So they are common. You can say many of the people, they are suffering from pelvic floor dysfunctions. Every other person has some issue going on with the pelvic floor, other the tension, other the weakness. So what you have to give to which person, you have to decide after taking the symptoms, after taking the history. Pelvic floor dysfunctions they're not normal. It is not a normal thing that, okay, we should accept. Pelvic floor dysfunctions are socially and emotionally crippling issue. We don't discuss about this issue because they're related to that private health, personal health, intimate health. We don't talk about that. We don't discuss freely about that. And we still treat it as a social stigma and social taboo. We think that talking about that is not good. Okay, but no, these are the issues. You don't have sex every day, but we urinate 6 times a day. we defecate every day. So the part is not only involved with the sexual area, but this is all bladder health and bowel health is also present there. Back health is also correlated. So it's very important that don't avoid it. It is important to take it as an important part which you should look for the rehab. And as a physio, we should also give them the rehab. You are treating everything, the complete core, the whole body. Just you are missing pelvic floor. So you are not completing their care. So complete rehab is still missing. So just to add that pelvic floor, you can give your patient a complete rehab, head to toe. So that is important. People with urinary pelvic floor dysfunctions feel embarrassed, shameful, fearful, and humiliated. You can understand that if I can't have sex, if I have vaginismus going on, I can't have sex with my partner. So always it is an embarrassing situation for me, and I might because of me, it is affecting me, and it is also affecting my partner. He can't even have penetration. So it is embarrassed situation. If I'm leaking whenever I'm doing I'm into social activity, if I leak, again it is an embarrassing situation. If smell is coming out, bad odor is coming out, it's an embarrassing situation. If I do the farting, it is an embarrassing situation. So shameful, fear, and it is the person is feeling shameful, and it is also now the fearful for them also, that they don't want to experience this kind of behavior again and again, and they might feel humiliated as well. People normally have a lack of confidence and very poor image, which might affect their personal and intimate health. Some people may unable to control urine and even start isolating themselves from the community and avoid performing daily tasks due to poor hygiene and order. You might have seen elder people in your family, they are not coming outside. They are not traveling because they are thinking that if whenever they will travel, they can't hold urine, they have to use washroom again and again. So that's why they're avoiding going outside. So you can understand their social life is affected and they are isolated in their room. So Kegel is not everything. This is what you learn from today. And you can learn more through our online, offline workshops. You can join us and learn it in more better way. And this is actually the plan which we have in India. But yes, definitely, you can call me anytime. You have my number. I'm there in the group also. And it doesn't matter if you have learned from me or if you have not learned, it is okay. If any person comes to you or any question comes to you, you can always directly message me on my number. And definitely I'll get back to you. And it's not like you have to, you are already spending, it is your interest that you are there into the workshop in this webinar today. But don't stop your learning. Resources are there, books are there. You can read the books. I know the books are a bit expensive, but it is okay. Books are there. If like around 8,000, 10,000, like $100, that sort of the books are there. They might be available, not available, but whatever is available, gather the information and learn from them. And books are like you have to spend your time. You can also learn through the YouTube. You can also learn from the Google Scholar, those kind of things. They will helpful. Or you can always ping me. And if you have any question, if any case comes to you and you don't know, you haven't taken any training, but you want to treat, you want to help, send me a question that, ma'am, I have this patient, can I help her and how to help her? I will also I will guide you the treatment program. So, but for treating the person, you should have a detailed understanding, more learning, but still if that is missing, I'm always there to help all of you. So thank you so much, everyone. And yes, definitely, I'll send you the reference of the book related to the pelvic floor. I will also send you the PDF, whatever is available. You can go through the PDF. Okay, learn and read. Thank you so much for your precious time and joining me today on this in this webinar.